desperate women in the news lately who have gone to extreme measures to remove their own breast implants. What's happening here? Makes us wonder why these women can't get the kind of medical care they feel they need. My next guest says that women don't have to act this desperate in order to get their breast implants removed. This is Kathleen Anakin. She is a registered nurse who says there are plenty of places to have breast implants removed, even if you don't have the money. And then I guess there's the Dow people who say they'll cover you up to $1,200. And this is Dr. Robert Tornambe. He doesn't understand the hysteria. He says the breast implants are perfectly safe. Dr. Tornambe, I want to start with you. Now, you examined Marlene and Denise. We asked you to do that. What's your opinion? And you've heard their interviews. What do you think?
Yes, I did examine both patients, and I'd like to just clear up something. The FDA, after an exhaustive study, came to the conclusion that there simply was not enough scientific evidence to warrant the removal of breast implants completely from the market.
I have to object to that.
Can I?
Sure, object if you
The
wish.
FDA came to the conclusion that there was not enough evidence to prove that implants were safe. Therefore, they've allowed them to be on the market for scientific studies only.
After an exhaustive study by a panel of physicians that are not plastic surgeons, rheumatologists, immunologists, epidemiologists, they have stated that there is not cause and effect relationship to many of the claims that have been made against implants.
We don't know if there's a cause and effect relationship yet.
Why do our rheumatologists and our internal medicine doctor and our neurologists say they've got to come out now, you won't get better till they come out?
Again, following the FDA guidelines, which is what we all would like to do, is in your case exactly the proper thing to be done is if you have symptoms that you're describing, then your plastic surgeon should, and I am certain, would be available to remove the implants.
I don't think we can go along with what the FDA says because they didn't do the testing for 30 years.
Well,
I mean, I've lost faith with them.
That's your government agency
Right.
that oversees
I'm
these
sorry.
things.
What do they consider scientific proof? What do they need as scientific
Right now,
proof?
according to the FDA studies, that these are physicians that, again, that have looked over the scientific evidence that has been present. What has been going on is that what they're calling what your problems are anecdotal in the respect that yes, you have a definite problem, and we're concerned about that. As doctors, we're very concerned about that. And with people like in your situation, you have the implants, you're having these symptoms, by all means, I think any plastic surgeon, any doctor right now would say, by all means, the implants should come out because you have these symptoms.
If so,
my concern is, however, that there are hundreds of thousands of women that have implants that have no symptoms, that are very pleased with their results. Especially women with implants that have had reconstructive surgery similar to yourself that do not have symptoms, have a normal way of life, and are very pleased with the way they look because
Some doctors are using that as an excuse, though, to ignore the people that do have problems.
Yeah,
no, we're not ignoring them. We're very concerned. No, we're very concerned about you
Doctor,
people.
why aren't mine out? It's been 2 months now.
I can
Why
tell
aren't
you
mine
right,
out?
if you came to me, I'd be happy to take them out. As a matter of fact, there's a hotline that the American Society of Plastic and Reconstructive Surgeons has set up for people just like yourself that have symptoms that are concerned, even if you don't have symptoms, to get free counseling by board-certified plastic surgeons.
Why haven't we heard about this? I've been going to my doctor for 3 years.
That's why I'm here. I want people to know that there are
Let's do that because that's a step in a positive direction. You're saying there is a hotline where they will make referrals to people who
are concerned. They don't even have to want their breast implants removed. If they are concerned, if they have questions, they will be hooked up to a board-certified plastic surgeon who will answer their questions.
Now,
if they then say, well, doctor, I can't find a doctor to remove my implants, board-certified plastic surgeons appall that kind of an answer, and we will help you and assist you in finding a doctor to remove your implants.
Now, let's go to Marlene. You examined Marlene.
Yes,
She's
I did.
had this. First of all, should she have had the implants put in the first place? She met 3 of the criteria that you gave to us.
Right.
Family predisposition,
Again,
numerous biopsies, and great deal of pain. So she met 3 of those criteria.
It's an indication for the operation that she had. Someone asked earlier, was that malpractice? Well, no, it wasn't. She had multiple breast biopsies. She had fibrocystic breasts, which means that they're very difficult to distinguish those tumors from cancerous tumors. She also had breast pain, as I understand, and multiple biopsies.
So that was done correctly.
So that was appropriate indication.
Why is she still draining after a week?
Everybody's body is a little bit different.
Okay.
The fact that she's draining is not an indication. The drainage will stop.
All right.
That's
and
not a problem.
Denise, what do you think should be done for Marlene? What can be done for her now?
For Marlene, I think there's some very excellent reconstructive procedures that can be done. There's something called a tram flap, which is a tummy tuck operation where we move skin, muscle, and subcutaneous tissue, fatty tissue, from the tummy and move it up, and that can fill those pockets that she now looks very deflated, and those pockets can be filled with autologous tissue, her own tissue.
And hope it doesn't die,
Okay, question.
right?
I wanted to ask
incidence of dying
Marlene,
is very low.
18 years ago when you went to the doctor and he told you you might get cancer, did you go for another opinion? Or did you just stick to what he said?
I saw my OBGYN, and he was the one that told me eventually I would have breast cancer, but I don't want to be the one to treat you because I don't do that. And he referred me to a plastic surgeon, and the plastic surgeon agreed with what he said. So that's two opinions.
Question.
So Marlene, I wanted to ask you, did you cut them out because you wanted to, or because a couple of months ago someone else did it?
I had been thinking, how am I going to get them out? How? And when I heard that someone else had gotten theirs out, I said, I can do it too. I mean, I can do anything anybody else can do. I have a lot of self-confidence. But I didn't try to take them out. I just wanted to get them ruptured, punctured, so that they would know they had to come out.
Sally, I want to know, who do we hold responsible for making these people this desperate to do these kind of things? Is it the HMO, the doctors,
Letting
the
this
FDA? You know, there's...
Ask them.
You know, who do we hold responsible? I mean, these women aren't crazy.
No, they're not
And
crazy.
if you've been in an HMO, excuse me, you know that it's all paperwork. They'd rather not do
And we
a
were
lot of
never
things that cost money.
forewarned.
They try to push you off
You know, it
late.
used to be that insurance would pay for complications from breast implants. My insurance company paid for 4 surgeries that I had for complications. And when I started the network, Command Trust Network, to try to find other women that I could talk to, because I felt the same way these women did, no doctors would remove my implants, and I didn't want new ones put in, I found that I was talking to women, and we went public, and we let people know that there were a lot of us in trouble. All of a sudden now the insurance companies won't pay. Where were the insurance companies? They knew about all these complications many years ago, and nobody bothered to tell the women until we told ourselves, each other.
Do you agree, Doctor?
We're very concerned about it. One of the reasons that we made such an uproar when the FDA was when the media and the FDA was bringing this out was, how are the insurance companies going to react to women that medically need implants, women that need breast reconstruction because their breast is removed because of cancer. Now, this, quite frankly, gives the insurance companies an excuse to remove the coverage of breast surgery, period. And now this is something that again, plastic surgeons are concerned about.
You know, in the state of Maryland, Delegate Pitkin has introduced a law, I don't know the status of it right now, where the insurance companies will be required to pay for complications from breast implants, just like with mammography laws.
About 1 to 2 million women out there who have breast implants. Do you think all these women should consider having them removed?
Well, it's our opinion, and based on what the FDA has looked at, the studies they have looked at, that 100% of implants will rupture given a long enough period of time.
Do you agree,
That's not
Doctor?
what the FDA have stated. The FDA's recommendations are that the implants, if the patient is not having symptoms, that the implants should not be removed.
But over
I don't
time,
think the
it could get
FDA
weak.
should even be considered.
If you have the symptoms, then yes, then they should be removed. But
Now wait, the
there are
nurse is saying if there are 2 million women watching us, they're saying every one of these women will eventually rupture. Is that what you're saying?
There is very little information.
That is not
the
true.
information that is available,
don't
that
know.
it was done at the Carl Clinic in Illinois by Dr. DeCamera, and it's just a report. It's the patients, and I really wish I knew how many, but I don't remember how many patients in her series. After 10 years, she was removing implants. After 10 years, the age of the implant being at 10 years, most of these implants were ruptured. And the older the implants were, the more often she found them to be ruptured.
So you're saying
now, it only
eventually-
makes sense.
Let me just, I have to keep you to point.
Right.
Sorry. Are you saying that every woman who has implants, those implants will eventually rupture?
if she has them long enough.
The body breaks it
Okay.
Now,
down.
the FDA says ruptured
Nobody-
implants should
nobody
be
explained
removed. I'm
All
saying,
right,
why
Doctor,
wait? if you
she's
want them out
correct in what
now?
she's saying.
According to the manufacturers and according to the FDA, we simply are not sure.
Okay.
My question was, what is the normal cost to have the implants removed?
Doctor?
That varies from city
And
to
it's
city.
much more difficult than having them put in.
No, it's not. It varies from city to city. In New York City, anywhere between $500 and $1,000.
Polyurethane is more difficult to take out because the flesh or whatever the fascia in there has grown into the implants.
Marlene, I've taken out many polyurethane implants, and they're really, if you know what you're doing, they're not difficult to take out.
Every plastic surgeon I talk to, I get a different explanation about it.
Different story.
Yeah.
Sorry.
In fact, my rheumatologist said there's only one doctor he would permit anyone in his family to go to have polyurethane removed.
Take a break, we'll be right back. Dr. Tornambe, you're quoted as saying that the women who want breast implants for cosmetic purposes are now going to want the saline implants instead of the silicone, and they're not as good. Are they not as good?
In my experience, the saline implants, the newer models, are better, but as far as consistency, as natural feel, as texture-wise,
they're not as good.
They're just simply not as good.
Plus the bag is silicone too. The shell. The shell that the saline
But
is
it's a difference. It's not the gel.
Yeah.
It looks like a plastic baggie. It happens to be.
Kathleen, what do you think of women cutting out their own breasts to get the attention of a
Don't do it. Don't do it, because the risks of that procedure, the infection, there are women who have lost breasts because of infection. Also, you're releasing silicone. You want a doctor to do that so they are sure to get all the silicone out and that none gets into your system in the meantime.
We shouldn't have to do that.
I wanted to ask Denise what it's like for you physically on a daily basis. Do you experience pain?
I'm in pain. I've got chronic fatigue. I'm on Paraffin Forte for a pain in my shoulder and up my neck. And I stay in bed most of the day.
Yes?
Sally, I just wanted to say, I think this is a tragedy, and I think that it really reflects the way society views women. Women are expendable. Millions of women went through this procedure. There was no inadequate research, inadequate studies to figure out what was being done, and the medical profession just got right in there, and they were cutting away and
allowed it to happen.
Thank you.
Not true.
There were many clinical studies along the way. These latest problems, these symptoms that these two ladies are describing have just come about over the last year or so.
No,
they've been used for 30 years.
They've been used since 1964.
I'm not aware of it.
This kind of problem.
I'm
That's
not
the
aware
problem.
of it.
Plastic surgeons are not aware of the research or the documentation.
We're aware of the
You're learning
research,
about it.
and we're trying to learn every day, and we're concerned about it.
There was a symposium in Austin that I went to several months ago that was held with plastic surgeons on the panel, oncologists, radiologists. The information they had was at least a year old. They didn't know what was the current thing. People in the audience had more information than the panel had.
It doesn't surprise me. Dow, we hear an official statement from the Keith McKinnon, who is the CEO of Dow Corning. Dow Corning has established a research fund of $10 million. The most important objective is to answer those remaining questions women have about their implants. Dow Corning has a replacement warranty that provides women using Dow Corning implants a replacement device and $600 in financial support. And if your physician believes you need your Dow implant removed and you can't afford it, they will provide $1,200 to support the medical costs. Question.
Do you have to have a problem with the breast? Supposing you got implants and you just don't want them anymore. You're not having any problems with them. You just want them taken out. They won't just take them out?
Kathleen?
No, I had to visit 8 surgeons in 4 different states before I could get a doctor to remove my implant without putting new ones in.
Take a break. Kathleen, do you have any comments that you'd like to make?
Yes, there are insurance lawyers. If your insurance company refuses to pay if you have medical problems, at the ASPRS, there was a survey. 50% of the surgeons said they would remove implants for free. The ASPRS proposes to raise $4 million to push for implants. I think they could probably remove everybody's implants for free and afford to do it, and it would be, they would look like heroes. A lot of women want their implants out, and I think they shouldn't have to fight to get that.
Doctor?
Let's look at the big picture as well, though. There's hundreds of thousands of women with implants that are pleased, that are very happy, who have had breast reconstruction, or for cosmetic reasons that are not having problems. Let's not panic. Let's just keep our heads and let's seek the proper medical advice, follow the FDA recommendations.
We have 3 in the audience. You are planning on getting breast implants, correct?
For reconstructive purposes.
And you're going to have silicone?
Yes.
Even after all that has happened?
Yes.
Okay. You too?
Yes, well, I was diagnosed with cancer and I had a mastectomy, and I work as a performer too, so I did have the tram as Dr. Tornambe described, but I am still considering silicone after all the stuff is weighed out with the FDA. I think it's important for us to have a choice.
And you too?
Yes, definitely, and mainly one of the things that I'd like to really...
You don't know what's going to happen to you though, and once it happens, there's no cure.
But the only thing is that both of you legitimately reconfirmed and confirmed that you have listened to many things and you've not heard 2 things that are the same.
Right. Out of plastic
I have not heard anything that's the same either.
Out of rheumatologists and neurologists and my family doctor and everybody, and I'm seeing a specialist in Houston the end of this month.
It seems like doctors are patronizing us.
In the interim, I don't believe that I will be one in the 2 million.
If you're going to do anything, it's like.
Thank heaven. Question.
What I wanted to say to the doctor was, you said that there are women who are perfectly happy with them. That's now. What about 10, 15 years from now? You say wait and see. That wait and see attitude has always been the cause of so many things that are wrong. Throughout history, women have always been called hysterical whenever they start getting worried about something. That wait and see attitude is like closing the barn door after all the horses have run away. What do you do after that wait and see attitude when all the women are running around with
take a break.
Kathleen, do you believe they ought to have silicone?
I'll tell you, I would never do it. What I know, I'm in touch with 14,000 women who are having major problems, including mastectomies, because of the silicone, which is why I had mine out. But now, at least women will have an informed consent document. They will read it. They will not be tricked into buying something like we were, which is illegal. It's illegal to experiment on people without their permission. So you'll know that you'll be involved in experiment testing implants.
The symptoms are so bad. I'm not kidding you. I couldn't get up and go to the bathroom in the middle of the night without taking a pain pill.
Also, Sally, the mammograms that my doctor took, the second one, did not show any rupture.
No, they don't show
So I almost bled to death because when
there was a rupture.
Yes.
Question.
Yeah, I would like to ask Marlene, when you first used the scalpel, wasn't you scared you was going to get an infection?
No. I was not concerned I'd get an infection because I felt that I would be treated that day, and I knew I would be put on antibiotic that day.
And you were in the hospital.
And I was in the hospital when I did it.
Sir?
Yes, this is to Mr. Dr. Tornambe. I would like to ask you to take yourself out of the medical profession for a minute and ask yourself, are these situations, they seem to be a bit sexist at times, sort of like the abortion situation, how like a lot of men, and I don't want men to think I'm selling y'all out, I'm still on y'all side, but it seems like a lot of men make decisions for women, like, women have problems that even as a doctor, as a man, I don't think you would understand. And then would it be the same if it were men with implants?
Plastic surgeons are doing breasts.
There are many women plastic surgeons doing, and there were women experts on the FDA advisory committee.
Denise, what kind of tests will your daughter have to go through?
I think probably a blood test first, and then if it shows anything, probably a biopsy is the...
I've had biopsies and blood tests and a bone scan.
There's no reports of anybody's children having problems.
And there's something on my fourth left rib that's 1 1/4 inch that they don't know what it is. It's probably silicone. It could be cancer.
Question.
2 short things, Sally. First, where lies the responsibility of the individual who's having this treatment done? It's blame this one, blame that one, think, step back. You are the one who made the decision. I'm not judging you. I'm not judging you, believe me. Secondly, very quickly, I would think that if you have things wrong with your body to begin with, why put something foreign in it to make it worse?
We were told it was safe.
We were told it was a one-time thing.
Yeah, we weren't told that we'd have to have the procedure done repeatedly.
Quick.
if it only costs $1,000 for you to go back to your plastic surgeon and have them removed, why not just pay it out of your own pocket and get it done?
The hospital charged me roughly $3,000. That was just the hospital.
The second surgery cost me the cost of the insurance company $5,000.
Boy, we have everything ranging from $500 to $5,000.
Many plastic surgeons have their own operative facilities that can do it in their facility. They have fully certified operating rooms in their office that can be done.
Take a break.